is a very new concept, probably not from a research and development perspective, but certainly from a clinical perspective, it is very, very new and it's very emerging. And many patients are now choosing to have sperm DNA fragmentation tests done, especially maybe not just as a first line approach, but certainly when there is failed IVF or repeated miscarriages. So, it's really fascinating that men can absolutely have a normal sperm count, but yet can have a impaired DNA fragmentation test. So we're going to hear a lot about this from Professor Lewis. So welcome, Sheena. It's absolutely an honor to have you, and thank you so much for accepting our invitation.
It's my pleasure. It's great to be here, and there's nothing I like better than talking about male fertility. So we'll have a very happy half hour, I hope.
Brilliant. And I must say, there's very few people who are passionate about male factor infertility. And I know during our interactions, we've had such amazing and really focused conversations about how men are ignored in the whole equation when it comes to fertility. Yes. And it's revolutionary that how much we have found out in the last 5 to 10 years about impairments with the human sperm. So I think we're just at the tip of the iceberg, but yet it's a very exciting phase in reproductive medicine, whereby even in conferences, we are hearing more and more about male factor infertility and DNA fragmentation being one of them. So Sheena, for our audience, do you mind just explaining in very basic terminology, what is sperm DNA fragmentation?
Well, inside the sperm, there is very little. It's not like any other cell in the body. All the other cells in the body can repair damage. They can create proteins. They can do all sorts of different things, but the sperm is very, very focused. There are two things that a sperm can do. One thing is it can swim. It's got a very long tail, and it can swim the marathon journey, which takes it to the egg to fertilize the egg. And the other thing it has inside is very, very tightly packed DNA. And that DNA is really the only thing that the sperm needs, because when it gets to the egg, it fertilizes the egg, releases its DNA into the egg, and then the DNA of the sperm and the DNA of the egg come together, and that's what creates the embryo. Now, the problem is that because sperm have become so specialized, they have lost all their repair mechanisms. So if anything goes wrong with the sperm, with its DNA, it can't repair it. Now, nature has done something very clever to avoid this being a big problem. Sperm production is probably one of the most extravagant processes in the human body. A man could produce up to 500 million sperm in one ejaculate. So that's a huge, huge number of sperm. But the problem is that lots of those sperm aren't very good. And so what we have to do is to try and find the very best sperm, as we do in IVF, by different ways of preparing the sperm in the lab, and also with ICSI, picking one particular sperm and injecting it into the egg. And in that way, we hope that we're picking the winning sperm, the one that will actually be able to fertilize the egg, create a lovely embryo, and then eventually that will turn into a healthy baby.
Okay. So when should one suspect sperm DNA damage?
Well, I think most people have DNA damage. That's the thing. Because the DNA can't be repaired, and because in the 21st century we live in a very, very dangerous world, with lots of pollutants, with poor diets, with overweight, with diabetes, with cardiovascular problems. We're not a very healthy species, really. If you were to go and look at horse sperm or ram sperm or dog sperm, you would find that all the sperm are absolutely perfect. But if you look at the human male, you can find that the vast majority of the sperm are not good. And we know this even if you look at a semen analysis. We think that very, very few of the sperm even look normal. And that's what we call morphology. Now, in a semen analysis, which is the gold standard, and that's the very first thing that a man should have tested, have a semen analysis, which will look at the concentration, the number of sperm that he has, the motility, can his sperm swim well, And would they be able to reach the egg and fertilize it? And then thirdly, the morphology. But none of those things actually tell you what the inside of the sperm is like. They're all just a superficial look at the outside. And it's the DNA, the inside of the sperm, that is going to make a man's child look and act like him. So really, that's one of the most important parts of the sperm. Now, when should you suspect DNA damage? We have done lots of tests on many, many men throughout my research team's life. And even fertile men have a little bit of damage. Nearly all men would have maybe 10% damage in their sperm, but that's okay. That doesn't seem to be enough to prevent a pregnancy or to cause a miscarriage. But if you get over a certain threshold of damage, then that's where the DNA damage can lead to all sorts of problems and failed pregnancies. And so that's, we can suspect problems with virtually any man. But one of the things that we have found, which is quite interesting, I'm sure you all know that about 25% of couples who go along to a fertility clinic are given a diagnosis of unexplained infertility. And that is an absolutely horrible diagnosis. It's horrible for the clinic because they don't know what to say. And it's horrible for you, the couple, because you think we're saying, well, there's nothing wrong with you. Well, of course there is something wrong. Otherwise you would have that lovely family that you so desire. But the thing about unexplained infertility is that a man has got the right number of sperm, they can swim perfectly, and they look okay. But what we have shown is that about 75% of men with unexplained infertility have high DNA damage. Now, because we know that, then if you have a diagnosis, then you can then lead to a treatment which is going to resolve the problem.
Absolutely. So it almost insinuates that we should be testing for sperm DNA damage at the outset rather than a secondary or tertiary, assessment of the male.
I really think we should, because if you think of the number of tests that women are offered, many, many tests, every year that goes by, there's another test for the woman. And yet with semen analysis, that's a test that was actually invented for artificial insemination of animals in about the 1940s. And it has hardly been improved since then. It's quite a blunt instrument. I know we've got to do it. It's the first test, but we really need to create some better tests for men. And this is why I'm so passionate about the fact that I think men have been left out in the cold. They've been put to one side. And because fertility clinics are very often run by obstetricians, and obstetricians are trained and skilled in looking after the woman, then we're inclined to think that the man is just an afterthought. And what happened last year, the HFEA published national statistics which showed for the very first time that male infertility was the most common cause for couples going along for infertility investigations. And that's absolutely shocking. Here, over 50% of problems are coming from the man, and we're still using an outdated method of testing. So that's why we're so keen to develop new tests. And like Alpesh, I have seen huge advances in the last 5 years in terms of lots of tests coming out. And I think that can only be to the benefit of everyone, and hopefully will lead to an increase in improvement in success rates.
Absolutely. No, I totally second that I think we should be doing sperm DNA fragmentation as a routine test, as a wellness check on men when they come for their investigations, because you'd rather correct a problem at the beginning rather than in their second or third cycle.
Absolutely.
So I agree. So are there any symptoms in men who for sperm DNA fragmentation? Is it symptomatic in any way?
No, it's a hidden problem. Now, sometimes there's a relationship between inflammation and DNA damage. So it may be that a man has had a really bad flu. There's no doubt that about 3 months after Christmas, when men have been having a really good time around Christmas and New Year, that the quality of their sperm can become a little bit worse. It takes about 70 days or a little bit more than 70 days for a sperm to be produced and go from A to Z. So if a man is drinking a lot, which is absolutely fine over Christmas, or doing whatever he's doing, then it could be that 2.5 months after that, his sperm are not quite in good shape. Also, if he's had a fever, and of course it'll be very interesting to see what happens after COVID-19. If a man has had a fever, it can have an effect on his sperm later on. But in terms of a man thinking, gosh, do I have DNA damage? It's like saying, do I have poor sperm motility? You wouldn't know until you look at the sperm in the lab.
I see. And, you know, what does the test involve? Of course, it means sending you the raw semen in terms of in a frozen state, you know, presumably. But how is the test performed in your lab?
Yes. Okay. I'll try and make it really, really simple. Our test is called the sperm comet test. And the reason why it's called the comet test is because it looks just like a celestial comet with a great tail that you would see in the sky. So what we do with the sperm is we take off all the membranes and we just take all the proteins away, and we're just left with the naked DNA. Now, if you remember back to your GCSE biology, DNA is a double-stranded molecule, so it's like a ladder. There are two sides to it and little steps in between. And if the DNA is damaged, when we put it into an electric field, so the little damaged particles of the DNA will be pulled out if there are little particles. If there's nothing wrong with the DNA, it'll all stay together in its little ladder, and it just looks like a star in the sky. But if it has lots of little fragments, these will be pulled out into the electric field and they will look like a huge comet tail. And the amount of damage in the tail is the level of the DNA problems that the sperm has. And if you've got lots of damage, you're less likely to get pregnant. If you've got very little damage, you're more likely to get pregnant. If you've lots of damage, you're more likely to have a miscarriage. If you've no damage, you're much less likely to have a miscarriage. And this, again, even talking about miscarriage, this is something which we've only realized in the last 8 or 9 years, that men and miscarriage have an association. We always thought, you know, if a woman gets pregnant, then anything that happens thereafter, it must be her body or her eggs or her embryos. But actually, there's very good evidence now to suggest that men's sperm quality has an impact on miscarriage, and high DNA damage can lead to spontaneous miscarriages. In fact, we have just written a paper and submitted it showing that DNA damage is higher after spontaneous miscarriages, after recurrent miscarriages, both by spontaneous conceptions and by fertility treatments. So there's a very common link here between men and miscarriage.
Brilliant, thank you. And, you know, with the results, how are they interpreted?
Yeah, well, there are a number of different DNA tests around, so it depends on which test you're looking at. But if you were to take the comet test, which we have, we can look at the amount of damage in, say, 100 sperm, and then we can give you an average, how much damage there is per sperm. We can also give you the proportion of good sperm that you have, which have very little damage, and the proportion of badly damaged sperm that you have. And all of these parameters have very close associations with, do you get good embryos? Do you get pregnant? Do you not have a miscarriage? And do you have a live birth? So there are relationships between each of the results that we give you and your fertility treatment outcomes.
Thank you. And if someone had a high DNA fragmentation, are there any medications that they can take to correct it?
The jury is still out on that, Albrecht. I know we think we should know the answer by that because we've been thinking about it for about 10 years. It's very difficult for me to give you the answer to that. We know that a good diet is very important. And that's one of the things that lots of us don't have. I mean, I'm sure many of you are like me. You eat food on the run. You know, you grab a sandwich, you have it at your desk, and we don't eat properly. So we can be lacking in vitamins. We could have a highly calorific diet. We think we're eating quite well, but actually it's low in nutrients. So antioxidants and vitamins are very important for sperm health. But the problem is that you can take too many of them. They're a bit like a double-edged sword. You can take just the right amount, which is usually what you get in your diet, and that's enough. But if you overdose, on over-the-counter pills, you can sometimes make your sperm worse rather than better. So we have to be very careful about that. I'm a great proponent of eating a decent diet and not worrying too much about medication. There are a number of things, of course, that are really bad for your sperm. And believe it or not, one of them is a medication for hair loss, which men are inclined to take, and it can actually lead to poor sperm quality. Another one, which again, men wouldn't even think was a problem, is the protein shakes that you can get in the gym.
Oh, really? Interesting. Okay.
Yeah. Lots of guys who go to the gym, and these can be within government permitted levels, but there's a substance called nandrolone. And as you can imagine, you know, anything to do with androgens or androlone is to make men bulk up and big muscles.
Yeah.
But
Yeah.
it is actually an anabolic steroid, and sperm don't like it at all.
Right. That's very interesting about the protein shakes, because the number of men that actually take them
Lots.
is huge. It's almost quite informative for me that maybe that should be one of the questions that we ask in the consultation, that is
Yes.
the man taking any kind of protein shakes in large quantities, of course.
Yeah.
Now, is sperm DNA damage reversible?
No, sadly it's not, because as I was saying earlier, sperm can't repair any damage that's within themselves. So a batch of sperm cannot improve. But that's one thing. But the other thing is, men are very lucky. Unlike women who have all their eggs whenever they're born, and the older a woman gets, the older her eggs are. So that's why female infertility increases with age. A man produces new sperm every 70 days from puberty, basically right through until he dies. And this is why we have quite a number of older men who have children, like Paul McCartney or Mick Jagger or various people, Elton John, older celebrities. Now, there are lots of older men, obviously, that nobody talks about or thinks about, but men can produce sperm for quite some time. So even though a batch of sperm might be badly damaged, and that damage is irreversible, if a man were to lose weight, stop smoking, stop taking cannabis, reduce his drinking, start exercising, create a much better lifestyle for himself, it could be that within 3 months or 6 months, those new sperm are much better quality than the last ones.
Right, thank you. Now, in terms of the IVF lab, because that's where I work, and often, you know, we ask ourselves that when you see a report with high DNA fragmentation, is there anything that can be done in the IVF lab for embryologists to be able to select sperm with better DNA integrity?
No. No and yes. No, there is nothing that you can do to select a sperm. That's a problem. We don't know at the moment how to select sperm with good DNA quality. It's not that a sperm that's got good morphology, that's got good outer structure, has good DNA. There's no relationship between those. So no, you can't select a better sperm. But we do know, and publications and papers would show, that ICSI works better with poor DNA than IVF does. So if a couple, for example, had unexplained infertility, they would usually be given IVF because the sperm looks as if it's okay. Now, those couples usually have poorer success rates than people who have detectable problems. So if you have a couple with idiopathic or unexplained infertility who have a failure with IVF, then my suggestion would be the next time round, go for ICSI. And I'll tell you the reason why, if you bear with me, why I think ICSI works better than IVF. One of the reasons why DNA gets damaged is because sperm have got free radicals. Do we know about free radicals? Yeah? We understand the concept of free radicals. Okay, so in IVF, you might put, how many sperm do you put in with an egg overnight in IVF?
About 100,000.
100,000. So if you had 100,000 sperm all producing free radicals, and you pop the poor little egg in overnight with 100,000 enemies, then she has to spend the whole night, you know, firefighting. And she may be fertilized, but the sperm that has DNA damage won't be repaired at all, because the egg is able to repair some of the damage that the egg has. The egg is able to repair the sperm damage. Now, take another scenario. You've got ICSI. You've got an equally poor little sperm with very bad DNA, but you've only got one. And the embryologist takes the egg and pops the sperm right inside the egg. Sperm heaven. And what does the egg do all night? The egg actually spends the whole night repairing the DNA damage. So in the morning, before the egg divides into 2 cells and then 4 cells, she has already repaired the damage that was in the sperm. So in ICSI, she's only 1 sperm to look after, and she can do that. In IVF, she's got 100,000, all producing free radicals and hurting her. And so she doesn't get an opportunity to repair the damage in the 1 sperm that does fertilize her.
That's amazingly well described, yes. And it's just that I think as embryologists, there is often this misconception that IVF would probably be better because it allows the natural selection. And that natural selection process may also be a selection of intact sperm in terms of better DNA sperm. So that clearly doesn't seem to be the case.
No. I mean, that's what you would think. Intuitively, you would think that that's the case, but it doesn't seem to be so. A very poor sperm can fertilize an egg, but it may lead to a poor embryo quality, or it may lead to no pregnancy, or it may lead to a pregnancy and then a miscarriage.
Sure. You know, we also, I know we spoke about the fact that we think that this test should be offered more routinely to men. Do you think that there is an opportunity or a chance that this test could be offered by the NHS? Because all the NHS offers is a routine semen analysis. Mm-hmm. Do you think there's ever an application of this test at the primary care level?
Oh, I think so. I mean, who am I to say? And at the moment, the problem is that the NHS is reducing the amount of funding rather than increasing it. And after COVID, goodness knows what the case will be. But I certainly think that men are highly disadvantaged in not having a proper workup. I mean, there are lots of other things that I think men should have as well as a DNA test. For example, they should have a clinical history taken. I mean, we know there are things that affect a man's fertility, like mumps, and nobody ever really thinks about that. We very seldom really look in semen to see if a man has any indication of an infection, especially if he's got a normal number of sperm, if he's an unexplained man. And it could very well be that he has an infection. Now, you can see that in his semen because there are lots of white blood cells. And it could be that he could be put on antibiotics, and that would improve things before he goes for IVF. So I think getting a man worked up in the sense, doing a workup so that his sperm are at their absolute optimal before the expense of IVF. The other thing is varicocele.
Yes, that's right. Yeah.
I don't know if you know what a varicocele is. It's really like a varicose vein on the scrotum. But what it does is it increases the temperature because there's lots of very hot pooled blood. Now, your testes are outside the body so that they stay at 35 degrees and not 37 degrees, which is your core temperature. But if you have a varicocele on the testes, it increases the temperature, and then the sperm quality decreases because sperm don't like to be at 37 degrees. Now, we have certainly had numerous patients sent to us who've had a varicocele, very poor DNA, gone to see a urologist. The urologist said, oh yes, you've got a varicocele, let's repair it. Had a repair, and 6 months later, their sperm quality is much better and much lower DNA damage. So those are the sorts of things that I think men should be offered on the NHS as well. But
okay. And in terms of, fresh versus frozen sperm, and we often get asked as embryologists, that is fresh better than frozen. Now, is there any difference in DNA damage between fresh ejaculated sperm versus frozen ejaculate?
No, thank goodness. No, there is not. And an indication of this would be that frozen sperm has been used from donors all around the world, from sperm banks, and created healthy babies for many, many years. The one advantage about the sperm, because it knows it can't repair itself, it thinks that prevention is better than cure. And the DNA in a sperm is packaged in this very, very odd way, tiny, tiny, tight form of DNA, formation. It's totally unlike any other cell type. And because it's so tightly packed with special proteins wrapped all around it, it protects it from damage. So you can do lots of things to sperm. You know, you can heat them up in the lab, you can freeze them, and you can thaw them out again, and the DNA is not damaged by those processes. So it's absolutely fine.
That's good to know, because we often get asked that, will freezing the sperm increase the DNA fragmentation? And then the answer is no, that it doesn't. Now, when you get a sample with high DNA fragmentation, is there any risk that these sperm will lead to more genetic abnormalities in the embryos, such as chromosomal abnormalities?
There's none that we know of. Absolutely none that we know of at the moment. We're not really looking at the same things. When you're looking at the DNA, the way I try to describe it is, if you're in an aeroplane and you're flying over a forest, what we're looking at is just the amount of damage in the whole forest. And that's what our DNA fragmentation is like. You know, we're unwinding the whole package of DNA in the forest, and we're just looking to see if there's any damage. Now, when you're at a chromosomal level, it's like flying over the forest, and you're only looking for the beech trees, and none of the other trees matter. And that's what you're looking for in terms of, you know, specific chromosomal anomalies. Now, that's not what we're doing, and we don't know of any relationship between DNA damage and chromosomal anomalies. That said, as you know, Alpesh, there are lots and lots of time-lapse ways of looking at embryo quality now. And we're involved in a couple of studies at the moment with American universities where we're looking at the relationship between DNA damage and embryo development and embryo quality. So ask me to tell you the answer to that in 3 years' time, and I'll try. But at the moment, we don't know.
So there's a lot to look forward to as far as, you know, genetic abnormalities in embryos go. Now, you know, you alluded to lifestyle changes in men with regards to DNA fragmentation. You mentioned smoking, drinking, weight, diet. So is there anything else that men can alter in their lifestyle? And specifically, whilst we're in a bit of a lockdown and fertility treatments are yet to resume, many patients ask us this question: what can we do when it comes to our lifestyle to improve the quality of our eggs and the quality of the sperm? What would your advice be?
Well, the first thing I would say is try and stay calm. I know this is a very difficult time for many, many of us, and particularly for couples who have had their treatment stopped, and maybe they're in the woman is 38 plus, and great concerns about when treatment is going to begin again. And I think that the thing to do, and I know how difficult this is to try and stay calm, not to get stressed, and not to be upset. There aren't very many studies really that show that stress has a very, very negative impact. So don't worry about it. If you are stressed, don't think, oh my goodness, I'm spoiling my chances. That's not the case. But it's just, it'll make you a lot happier if you can avoid stress. Exercise, we know that all exercise is good, apart from marathon cycling. That's the only sport that I would say does not have a good effect on sperm, possibly because of where the genitals are, where the sperm are high temperature, lycra, goodness knows what, lots of pressure on the nerves around that area. But anything else you want to do, go and do it. Try and do things in moderation. Smoking is the one thing I am absolutely, totally against in any form. I mean, smoking is bad for your health. It's bad for every single system in your body, and it's bad for your sperm. So if you can avoid smoking, please do.
Is there any evidence about e-cigarettes and
yes,
vapes and everything on sperm?
There is some coming out, and it's not good news.
Okay.
Not good news at all. And funnily enough, there are different flavors of cigarettes have got different effects. It's not even just the toxicity of the vape. It's the I think pineapple. The pineapple one's meant to be a particularly noxious one. Okay. So I wouldn't use those either.
Gosh. So this is very interesting, because I think men should really use this time sensibly to kind of optimize their lifestyle and kind of remove elements that can be toxic to the sperm DNA and sperm health. And finally, one of my questions is that, Is testicular sperm, because in the IVF clinic, sometimes we are resorting to using testicular sperm in men who do not have sperm in the ejaculate. Now, I know that there is some evidence about testicular sperm having lower DNA fragmentation compared to ejaculated sperm. So when do you think a couple should explore the use of testicular sperm over ejaculated sperm? Because it's a huge step to put someone through a surgical procedure.
Yes, I totally agree with you. It's also a huge step to have donor sperm. So I would be inclined to say that a couple should have had maybe 2 or 3 failed ICSI cycles before you go to this very invasive step of taking sperm from the testis. Having said that, we certainly have evidence in studies that we have done, and so do many others. There's quite a plethora of data coming out now to show that a lot of the DNA damage occurs between the sperm being produced in the testes and being in the ejaculate. There's this great long elongated tube in a man called the epididymis. And when the sperm are produced in the testes, they then go down this very long epididymis in order to be ejaculated. And it's in the epididymis that lots and lots of the damage occurs, DNA damage occurs. So if you have had a failed ICSI cycle, then going back to the testis is quite a good choice. I think there are going to be papers coming out within this year or within the next 6 months to show that for people who have failed, they have a better chance of success with testicular sperm in the future. It is invasive. It's something I think you have to think very carefully about. I suppose I would say it's not anything worse than all the things that a woman has to go through in terms of having superovulation and an egg collection. So it's, you know, and I know that there are many men who are very happy to have a testicular biopsy and the chance of having their own biological child rather than just going straight to donor sperm. So I think it's going to become more and more common in the future. I really do. Now, some of the work that we're involved in at the moment is trying to develop a diagnostic test for when you should do a testicular biopsy and when it will not be of any benefit. So this is really a test that will say, don't do it because it's not going to help, and you don't want to do something surgical unless you absolutely have to.
Sure. And you know, we often get asked by men in consultations that, can we take any supplements? Can we take any antioxidants? Now, we don't know which products in the market are good, and there's just so many out there. So without obviously naming any, but are there any products that our viewers should really be staying away from? Or specifically, what are the specific
ingredients,
antioxidants that they need?
Yeah. There aren't any that I would say, they're absolutely dreadful, stay away from them. But there aren't any that I would say, hand on heart, this is really going to be good for you. I think over-the-counter supplements are as good as anything. You want vitamin C, you want vitamin E, definitely. You want selenium and you want zinc. And apart from that, there's nothing really that you can say, oh, that is going to improve your sperm quality. But I mean, as you know, Alpesh, the jury is really out on this. Many studies have been done, but there's nothing that has said, this is the way to go. And nothing seems to have had a big increase in success.
So we've got a question here from a couple of viewers. So one of the viewers is asking, we were about to go on our 4th ICSI cycle in April, but obviously postponed. We're diagnosed with male infertility. I asked consultant on the 3rd cycle to review sperm DNA fragmentation and was told it's not necessary. But after doing research during this time off, I feel I need to push for it. Sperm morphology, motility, concentration are lower than the normal range. I am 40 and have a low ovarian reserve. Do you suggest I push for DNA fragmentation test?
Yes. I think in that situation, it would be money very well spent. In fact, what I would do if I were in your shoes would be, bearing in mind that you've got male factor infertility, I would seek out a male specialist in terms of a urologist. And this is a person who is going to have been trained entirely on looking after male reproduction. So they will have a, you know, a high level of knowledge, and they will give you clinical history, clinical examination, talk through your lifestyle and see if there's anything that can be done to help, because you want to do everything you can to optimize your sperm for the next cycle.
Absolutely. And the same patient has written another question. Please, can you explain the process of doing the fragmentation test? Example, sperm sample taken and results given. Then is the sample voided, or can it be frozen to be used for ICSI? If, for example, the results were good quality. Mm-hmm. Conversely, if there was high DNA fragmentation found, do you advise waiting for approximately 70 days and trying to make positive changes to help?
Yes, well, in terms of doing the test only takes a tiny number of sperm. So if a man produces a sample, even if it's an oligospermia, you know, he's got a low sperm count, we only need a tiny, tiny number of sperm to do a DNA test on. So yes, we can do a test on that tiny little sample and then say, yes, it's a high DNA damage or it's a low DNA damage. And then the other portion of the sperm can be frozen and ready for use, for clinical use. So there's no problem at all about that. If you find that you have high DNA damage, yes, I mean, we provide this service, as do others. And the idea would be that you would go and maybe see a nutritionalist, or you would go and see a urologist, see if you've got a varicocele, see if you've got an infection, see if there's something that can be done to improve the quality of your sperm. And as you say, 3 months later, then have another test and see if you've managed to improve it. And I think it's quite a good idea to you know, to wait rather than going straight into doing a cycle immediately when your sperm quality is not any better than it was the last time when you had a failure.
So it's a bit of a double-edged weapon, Sheena, because with women with low ovarian reserve, obviously the pressure is to continue with treatment as soon as possible.
Straight away.
How does a couple balance this out when ideally they would rather wait for the 60, 70 days for that sperm cycle, and yet the woman's ovarian reserve could keep on dropping further?
Yes, and those 2 months are absolutely crucial. Well, this is where I think the UK will start following America. And what is happening in those cases in America is they're doing testicular biopsies, because you know you have immediately got better quality sperm. You don't have to wait 3 months. You can have them right now. And I mean, that's certainly what's happening in New York. And I don't think it's going to be much longer before we're doing the same thing in London.
Very interesting, very interesting. And finally, Sheena, obviously a lot of men recreationally, you know, use a lot of gym, sauna, steam, jacuzzis. Is this something that men who are trying to conceive should totally stay away from?
Well, there have been many studies done saying, you know, high temperatures in saunas and even, you know, guys who are long distance lorry drivers, you know, that their testes get very hot sitting in one position. I don't think there's really a huge amount of evidence for that. I mean, if you have something like a varicocele and you're high temperature 24/7, that's going to impact on your sperm. But sitting in a jacuzzi for half an hour or you know, I think we've got to do things in moderation. We can make our lives so miserable that we just don't enjoy it, and then we're less likely to, you know, to be successful. So I'm inclined to take everything in moderation. I saw something up there about mobile phones.
Yes.
A moment ago. Yeah.
What's your opinion on that?
There is some evidence on mobile phones. There's some quite good evidence came out of Professor Aitken's lab in Sydney in Australia, saying that having mobile phones, probably okay to have them up, you know, in the pocket of your jacket, but not in your pocket of your trousers right beside your testes all day long. I would be inclined not to do that.
Thank you so much, Sheena. Absolutely a wonderful and informative evening. We've had so much to absorb in terms of novel information that's really coming out around male factor infertility, and certainly something very cutting edge and new, which is sperm DNA fragmentation. us as embryologists are learning by the day about it. And we're very privileged that we had that firsthand information from you. So I'm really thankful and grateful for you for your time this evening. And if there's any questions, you know, our viewers have, can they seek any further information from your website or anything?
Yes, absolutely. Yes. The company is called Examen, EXAMEN, you know, examining men and looking after men. So if you want to go on there, that's absolutely fine. I assume they can ask questions to IVF London and they could forward them to me. I'm more than happy to answer any questions that I can to help.
Thank you so much. And again, just to remind our viewers, if you need to get in touch with us, the email address is info@ivflondon.co.uk, or you can visit us on our website at ivflondon.co.uk. You can connect with us on the social media handles too. So thank you so much, Sheena. Absolutely a pleasure to have you. And we'll see you soon. Stay safe. Take care.
Okay. Bye for now.
Bye-bye.